Alright, so just trying to get a bit of this in before the program commences. So the idea is that we're going to be answering some questions, some IVF questions. That is essentially what the whole idea is. So, and why I'm choosing at this point in the night to say, oh, why are you having a session tonight? It's just because I know that there are some persons that are actually thinking tonight. I'm thinking, let's help them. Because I know what it is to sit and think and wonder. And the whole stress of everything is getting on them. They don't have a way out of it. So that's really what I'm trying to sort out here. That's the whole idea here. So, well, that's the reason why we're doing this tonight. The reason why we're doing this is because we're trying to actually answer some of the questions. So, as I'm getting them, that's how I'll be responding to them. Alright, so first one, we still have a minute to go. Okay, close service. Cost of closed service. Okay. Sperm not entering inside, alright. Okay. Alright, so this is the beginning, so we can still give some people a few minutes to get in. Alright, so what we're going to do is just start with the persons that we are here with now. And the very first thing that we're going to start with is a very common question. What is the cost of IVF? This question is one question that everybody wants to know the answer to. And we're going to answer with the fact that it actually depends on a number of factors. Some of them are what kind of IVF are you actually going for? That's question number one. IVF you are going for. So that is usually dependent on the age. In fact, okay, let's start with general factors. And the question we're answering now is, what is the cost of IVF? That's the question I'm starting because that's the first question I got. So for the age of the individual now, if you are less than the age of 40, usually you can have a different cost for IVF than somebody that is above the age of 40. Why? Below the age of 40, depending on how your egg quality is, you may actually be able to do IVF with your own sperm, your own egg, and that usually means that you are not doing a donor cost IVF. Now note that there are some clinics where the cost of doing an IVF with your own egg and your own sperm, and then the cost of you now doing an IVF with a donor egg and a donor sperm are the same. But it's mostly not like that. What you usually find is that your own egg IVF is cheaper than a donor egg IVF or a donor sperm IVF. So I'm going to answer this question giving an example of two clinics to tell you that your location is going to affect the cost of your IVF, which is something you should see. And even within the same location, you can have a different cost. So let's start with a clinic now in Enugu, where the cost of the IVF is 2.4 million naira. That is the cost of an IVF there. So if you are doing a donor egg IVF or you are doing a regular IVF, 2.4 million naira. Now let's move away from Enugu and come to Abuja, the cost of IVF there is 2.8 million naira. Location has changed. Let's go to Warri now for the cost of IVF in Warri. The cost of IVF there is on average about 2.3 million naira if you are using your own egg and your own sperm, and it's 2.5 million naira if you are about 2.5, 2.7 if you are using a donor. So what we can now conclusively say, because when this question is asked, you expect that you can get a single figure. So it depends on so it depends on the place that you are going to, but on average, for most facilities now, if you want to get an average figure for IVF, I would say you should be looking at between 2.2 to about 3 million naira for your IVF cost. 2.2 to 3 million naira as a basic cost. Now, there are certain places where it's way more expensive. There are clinics in Lagos, clinics in Abuja, especially, that you can spend 5 million naira for a basic IVF, 7 million naira for a donor IVF. There are places where you can spend 10. But if I want to give an average figure, what I can just tell you is that the cost of IVF will range between about 2.2, 2.3 to about 3 million naira. That should be a very good starting point. Now, when you also ask this question, what is the cost of IVF? There are other questions that you should ask that most people are not aware of. So, number one, excuse me, thank you. So IVF cost is actually broken down into multiple layers. That's why some people will be scared that there are some hidden costs in IVF. It's not necessarily that there are hidden costs. It's just that there are things that is broken down into that you may not be aware of before you start. That when you now hear that is between 2.3 to 3 million naira, you now believe that once you have that amount, you can just go through the process. Good and fine, for most people, you will get that for the process. But the first thing you should look at, the first cost that comes into IVF. The first cost that comes into IVF is one, you go to the clinic and you have your consultation / registration fee. For some clinics they get that for free, others get a consultation / registration fee first. On average, that can be between 20 to 30,000 naira. Then the second cost that comes into IVF is that for many clinics, you will do tests. You may come with your test if you have test results that are recent, and by recent we usually mean below 3 months. Anything older than 3 months, we are considering that one is an old result. There are also facilities that, because they want to be sure of what they are working with, they will prefer to use their own results. There are facilities like that actually, and so it also depends on all of these things. So that is that one. That is second cost. So on average, the cost of this testing now can range between 150 to about 300,000, 350,000. I'm giving a moderate cost. The clinic you are using may be more expensive or less expensive. It all depends. So that is the other cost of IVF. Then you now go to the actual IVF cost itself. And then for a number of clinics as well, after the IVF cost that they give to you covers from when you start the IVF procedure, you are placed on some medications to the point whereby the baby from the lab, let me call it the baby, is now the embryo, is transferred into your womb. And there's a 2-week waiting period after that where you are on some medications, then we now confirm if you have pregnancy or not. This stops at that pregnancy test. So after that pregnancy test, for a number of clinics, if you are pregnant, you now have to you're advised to take some medications to support the pregnancy. Those medications now are usually outside of the IVF cost. So those are usually the cost breakdown that come in when it's, maybe we'll make a full video that actually explains that usually comes into IVF cost. So just to recap, there are two things when it comes to what is the cost of IVF. Number one, know that your age affects it. Are you doing a donor egg IVF or are you doing a self IVF? We talked about the cost in different clinics, different places, from Enugu to Warri, Abuja, like that. We talked about those costs, and I came to a conclusion that we can say that on an average, you may spend between 2.4 to 3 million naira on the cost of IVF, depending on where you are going to. We now came down to also tell you that the cost of IVF is also is also something that is affected by is broken down into different points. So we talk about the first one being the consultation fee, the second one being the cost of doing your test, the actual cost of the IVF, and some cost of some drugs after the procedure. Then we'll go to the next question. A woman that is not seeing her menses, a woman that is not seeing her menses, can she get pregnant? Somebody asked, can she get pregnant naturally? Another person asked, can she get pregnant with IVF? So we're going to start with, can she get pregnant naturally? At the age of 50, to be honest, it's not that it is impossible. However, it is a great battle to actually have that, because for most women, off the top of my head, I would say for about 90 something percent of women, you may find that above the age of 50 they cannot get natural pregnancy. They cannot get natural pregnancy, but there are some set of women that can actually do so at that point in time. However, when you take that out, because of the fact that most women will not get pregnant without IVF at that age, we recommend for most women that they go for IVF if they are above the age of 50 and want to get pregnant. Then in this IVF that they are going to get, we also recommend for them that because they are not seeing their menses anymore, they should get a donated egg. Why are we considering a donated egg for a lot of this age group? Is because the sorry, the end of your menses often signals the end of your having eggs. When a woman is born, she is born with a certain number of eggs, and these eggs are what she sheds. Every menses that you see, every menstruation is a sign that this woman did not get pregnant. This egg that we produce was not used, discard. This happens usually from the age of 12, 13, some people even from the age of 10 till up to the age of often 40, 42. And the body exhausts the store that it was born with. So beyond that point, because the woman's own egg are exhausted, and even if they are remaining, the quality of those eggs, the chromosomal integrity of those eggs are also things that one also consider. You now start seeing that many of them, they require a donor egg. Then the next question is that at what age do we stop doing IVF? The sincere answer to that question is to start by looking at the oldest IVF pregnancy in the world. If I'm recalling correctly, she should be about 80 something years old. And the thing about it is that there are a lot of processes that went into achieving that. So on average, once a woman is at 60, most of the time we would not do an IVF. We recommend a surrogacy for her. Early 50s, depending, but late 50s into 60, we have a conversation about the reason being that IVF success is affected by age. So the woman that is at 45, at 40, at 30, at 28, 25, 28, 25 have a higher chance of having success than 50. So when a woman is not getting from there, when a woman is not getting from there to the other ages, what you now find is that um, we'll tell her that if you are getting to this point, you have to consider the fact that you may necessarily require more than one cycle. You may require more than one trial. If you are okay with that, if you are okay with that conclusion that you may require more than one trial, then it's okay to actually go ahead with the IVF. Maybe even though the woman is older than 50. Depending on some clinics they don't like the idea of that affecting their success rates and all of those things. I mean, they may not actually agree that they want to consider that kind of option. And they may not actually agree that they want to consider that kind of option. but it all depends on you and your clinic as well. But for most people, early 50s is where they draw the limit. Some may go into 56, 57, but maybe 58. But most people above the age of 60, they will not have a consideration for that anymore. Then, can 50 years get natural pregnancy? I've answered that. Is unlikely, not absolutely impossible. But if you have been trying to get pregnant for many years and you're already at the age of 50 and you're trying to get natural pregnancy, I will not advise you to do that. My advice would be do your IVF, because it means that there's something wrong with the process currently, and it's not the best of things for you to start trying to not the best of things for you to start trying to get natural pregnancy at that point anymore. The cause of closed cervix and is your sperm not entering. So the thing about closed cervix and sperm not entering is that there are there are multiple factors involved, and okay, let me not say multiple factors. There are different things that could be the cause. So, for example, some women are born. Okay, I was having reviewing a patient. I was yesterday, and she had a very small. Okay, the scan rather on scan she had a very small womb, hypoplastic, did not develop at all. So, this person may also concurrently have a small vagina, a small cervix, and may have issues with sexual intercourse. Some people may have had infections before at certain times that may make it such that they now had a kind of fibrotic healing that make that place very tight, and they may have issues with sperm entering. Some people may have had surgeries around that area that may cause, in the process of healing, everything to stick together, and they may now have issues in that area. So oftentimes there are different possible causes. If it's the sperm not entering, someone may have fibroids in the cervix, that region where the womb is supposed to, that region where the how do you call it, the sperm is supposed to be passing through to come in. Someone may have some fibroid masses there, and when they have that fibroid mass, do not allow it go inside, so sperm may come out. However, take note of the fact that the when the sperm is coming out of your body does not mean you don't have sperm coming in that are enough to make you pregnant. The body is not designed to just hold all the sperm. It's an open cavity. So even if your husband pours inside of you, it's still possible for some of it to flow out when you stand up. And it does not necessarily mean that means that there's a problem there. It's when we say there's a problem in getting pregnant, what we are saying is that you have met, if you are below the age of 35, you have been meeting with your husband 3 to 4 times a week, especially during the ovulation window, and he has been ejaculating inside you, and you have not gotten pregnant for a period of 1 year. That is when we say you have fertility issues. So if you are just newly married and you have only tried for 3 months and you are not getting pregnant, it does not mean you have fertility issues. So let's go over that point again. When we say that you have issues with getting pregnant if you are below the age of 35, it is that you have been meeting your husband 3 to 4 times every week, unprotected sex. He is not using anything like a condom, and he's pouring inside you, and you have been doing this around your fertile window, especially for the last 1 year. If you now go above that age of 35, we say you have been doing this intercourse unprotected 3 to 4 times a week around your fertile period, especially for 6 months, you have not gotten pregnant. That's when we say that you need to start doing evaluation. Then next question here coming minutes. I just want to answer a few questions very quickly. It's not supposed to be a long session. We'll be done with this in less than 30 minutes. Okay. Let me just confirm if there are any questions that I've not answered very quickly. A minute. because I went out. So requirements for IVF. The thing about IVF requirements is this. I usually summarize IVF requirement as this. If you've been having fertility issues, you went to the hospital and your doctor told you, I think you should go for IVF. That is mostly the requirement for us to start attending to you. That is really what there is. But the actual sense of requirement is like I told you before. You've been trying to get pregnant around that period that I told you, less than 35 for 1 year. You have been trying, you have been meeting 3 to 4 times a week. Your husband is using unprotected sex, is ejaculating inside of you, and you are not getting pregnant. 1 year, you can start going for fertility procedure, fertility checkup. It does not mean IVF here. So in fact, IVF is not option number one. IVF is like towards the end of options. If you're a younger couple, you start early, you come, we do tests, we check to see if there's anything that is going wrong. For some people, they may require drugs. For some people, there's what we call timed intercourse, when we are doing tracking of your follicles to see that you're actually developing eggs, and we see that you're at a point whereby your eggs are about to come outside. They will tell you, go and meet your husband at this point. I have a couple that just delivered their baby. Their baby's naming ceremony was a few days ago now. It was not anything IVF, it was timed intercourse. At a point in time, we saw 3 very good follicles there. We are going, was it 3 or before? Go and meet your husband. They met, she got pregnant, she did not need to do anything special. I have other couples that they came in and needed to take drugs, either because of the husband's sperm or the woman having ovulation issues or this issue or hormonal issues. They take medications, they get pregnant. There are patients outside of that one too that require what we call IUI. You collect the sperm from the husband, pass it through special procedures, get the strongest one, inject it directly into the woman's womb. So for that lady that said that maybe she's having difficulty with the sperm entering into her womb and is pouring out, an IUI may be an option to circumvent whatever is in the cervix and inject it directly into the womb. IUI now has the one that we do with the husband's sperm, or if the husband's sperm is not okay. IUI means intrauterine insemination, inserting it directly into the uterus. Then you have the one that will do that is a donor sperm. Before you now consider IVF, before you now consider surrogacy, adoption as options. So you can see that there are multiple steps to getting pregnant. So the requirement for IVF is that you have been seen by a doctor, preferably gone to a specialist, tested and reviewed, and we find that there are certain issues for which we consider IVF to be the best option, which we're not going to come around to probably rounding up from this point, which is the causes of infertility. What are the common things that prevent a man and a woman who are of reproductive age and have been trying to get pregnant for 1 year if they are below 5, or 6 months if they are above the age of 25? What are the things that may be stopping them now? Let's discuss this. We are going to remember that there are 4 categories of things that can stop pregnancy. Number 1, we call them female factors. Things things that are related to the woman. Female factors. Group number 2, we are going to call them male factors. Things that are related to the man. Group number 3, we call them mixed factors. Things that may be coming from both the man and the woman mixed together that are causing the issues. Then we now have another subset that we call unexplained infertility, which means we cannot identify a factor from the man, we cannot identify a factor from the woman, but they are not getting pregnant and we know that they have an issue. So these are the common causes. So we usually say males may have 30% of the problem, females may have 30% of the problem, then both of them join together may have 30% of the problem, and then there's a 10% group of people that tubes. Some of you here, you have experienced that your tubes are okay, your eggs are okay, your husband's sperm is okay, everything is okay, there's the hormones are okay, but they cannot find the reason why you're not getting pregnant. That is what we call unexplained infertility. When we now come to the female factors of infertility, now we can say, okay, what are some of the things that can prevent a woman from getting pregnant? We can now break them into hormonal factors. Let's say hormonal factors first. That one means maybe her prolactin is high. She's having thyroid function issues. Maybe Her progesterone has been a problem. Those are things that have been come from the woman hormonally that may affect pregnancy. We can also now look at, okay, are there things that are affecting the tube? Because they want tuber factors. The woman's tube is blocked on both sides, she cannot get pregnant. We look at it again, we say, okay, the woman's tubes may have what we call hydrosalpinx, which means on the two sides there is fluid inside, and that fluid is toxic to an embryo. She cannot get pregnant. We look at it again and say, okay, let's go to the uterine factors. That means the womb of the woman. Remember that patient I told you that her womb was so small, it cannot even hold a baby. It will be difficult for her to get pregnant because the womb is too small, it's not developed. That is a uterine factor. It can be that she has fibroids within the womb that are affecting, because the way fibroids is, I'm holding a pen now. Inside this pen, you can see the ink. That place that the ink is, let's say that is where the baby is supposed to grow. If the fibroid starts to grow inside this place and press that place, the baby cannot develop there. So that one now will be a uterine factor, a problem from the uterus, from the womb. We can see the one that are happening in the cervix, that is the area that is leading to the womb. Like that woman that said that her sperm is pouring out, and that's okay, maybe there is a fibroid in the cervix there that can affect the pregnancy, affect her from getting pregnant. You see, so they are broken down into these ovaries. What if our ovaries are not producing? That's why you see PCOS patients that have PCOS, their ovaries have issues with egg production and all of those things, and you see that the eggs are not developing very well. That is an ovarian factor. Let's leave ladies now, let's go entirely to males. So what are the things that are affecting males? One of the most common one is no sperm at all. Azoospermia, this man is pouring, he thinks that he's releasing sperm, but there is no sperm at all inside that ejaculation. That one will make the man not to get pregnant. You can see low sperm count, which is why there are some sperm, but the sperm are not strong enough. So some of those men, they need to do IVF, will do ICSI. Some just require drugs, that's all. Some need to stop alcohol, they need to stop smoking. Some need to stop wearing very tight pants. Some, the kind of work they do can affect. I was having a conversation with a colleague about halcon weggers and how a number of them may have some fertility issues, even though maybe it's an hazardous nature of their work. So you have to, those are some main factors. For some men, they also have tuber factor. Maybe the pipe, let me call it the pipe that is supposed to carry the sperm from the man's testis to pour outside, it's not carrying it. They will have a problem. Some people, they did surgery one time when they were younger and it affected their testes. Some, they had infections when they were younger and it affected the testes and it's making it difficult for them to have pregnancy now. Some men, is even hormonal interplay. Their hormones are not balanced, and that is why they are having difficulty getting pregnant. So the point is that there are different factors that can actually cause all of these things from going on. Then we now looked at mix. So maybe male have one, female have one, because there's this conversation that comes up amongst of fertility specialists, and it's this: for you to get a man or woman that will be pregnant, you need 100%. The 100% means from the man and the woman 100%. Now, it does not mean both must give 50-50. Somebody's fertility may be 80%, the other one is 20%, but together they are 100, they will get pregnant. So if the person that has that 80%, now means somebody that is only 10%, they will not get pregnant. Then the last one is now the unexplained one. So I don't want us to run for too long. We'll have this another time. I just had somebody reach out to me about she could not sleep because of some of these fertility issues, and my heart really went out to her, because I know how at night, thinking from all of this strain of trying to get, you are trying different things, you've taken medication, you've bought drugs, and you've done everything, and it just seems as though you are still not getting pregnant. Some of you have even done IVF the first time, it has not worked. I was discussing about the lady today that now has twin babies, but she did IVF 4 times. It's not easy. She did the first one, the second one, the third one, and now the 4th one before she got pregnant. And at night is a time that can be very, very frustrating. But I want to just encourage you to tell you that I've seen people get their babies after a lot of trials. 10, 15 years. I've seen people that did not give up get it. So it's possible for you. Have a very wonderful night. These 30 minutes have been enough. Stay very well. We look forward to helping you wherever we can. But if we are not accessible to you, just don't give up. Go to any clinic that you like near you and get your pregnancy. Have a wonderful, wonderful night. Bye, everyone.